I am Dr. Hitesh Garg. I'm heading the Department of Orthopedic Spine and Scoliosis Surgery at Artemis Hospital, Gurugram. Today, I'm operating on a 14-year-old girl with highly complex scoliosis where the angle of scoliosis is more than 100 degrees. So these are the pre-operative x-rays of the patient. Nowadays, what we do is we usually do a CT scan of the patient before surgery. So this is the CT scan. And what we do, we look at the CT scan from multiple angles. So here we can do it in multiple planes and we can study that the screws are perfectly placed and we can change the direction and see all our screws in exact alignments. All right, so let's now move to the operation theater. So in scoliosis cases, it is very important that we are calm. We have explained all the major steps to our entire team, which consists of our assistant surgeons, our anesthesiologist, neurophysiologist who will be doing neuromonitoring and monitoring the nerves and spinal cord during surgery. It's very important to explain all the risk factors, the detailed surgical procedure to the parents, which we have done in detail. We have done it multiple times and again reiterated the same in the morning. So while I'm going to the operation theater, I'm thinking of all the steps in my mind. I'm sort of revising the surgery in my mind at how I would be going ahead with the surgical steps. He's our neurophysiologist. Here you can see he's putting the wires. So this is one advancement which has revolutionized the scoliosis surgery and made it very, very safe. So here what we are doing is we are putting the wires in different muscles and we have put a wire in the head. So when we are doing the surgery, we are going to run a current from this and pick up the current from these wires. So it monitors the function of spinal cord. So when we are correcting the scoliosis, the biggest risk is there can be some insult to the spinal cord and the spinal cord patient can get paralyzed. To prevent that, nowadays when we are correcting the scoliosis or we are putting the screw, we are checking with these wires that the spinal cord and all our nerves are functioning correctly. And this has made the scoliosis surgery almost 99% safe. So this is what we were talking about. This is a neuromonitoring screen where our neurophysiologist is taking the signals. So before positioning the patient, we have made sure that all our signals are intact, that the spinal cord and the nerves are functioning normally. And now when we are doing the surgery, when we are correcting the spine, we would compare those signals with these signals. These are baseline signals so that there is no difference and our spinal cord is perfectly fine. So finally, we are getting ready for today's show. Today is a big day because we are doing a scoliosis surgery. So this is a scrub station where we clean our hands and forearms so that we are completely disinfected before we go inside for the surgery. So at our department for scoliosis surgery, it is always 2 fellowship trained spine surgeons who do the surgery. So today I would be leading the surgery and here it is Dr. Varun. He would be helping me with the surgery. He is also a fellowship trained senior consultant in our department. Now multiple scientific studies have proven that whenever a complex surgery is done by 2 spine surgeons, the complication rate reduces significantly and the success rates significantly go higher. And that is a policy which we are following in our department for the last 10 years. So now we are almost ready to start the scoliosis surgery.
a lot of people believe that only I would be operating, but actually it is a teamwork. So let me introduce you to my team. So we always do a timeout. We introduce ourselves. So here is our circulating nurse, floor nurse, who would be coordinating everything. And then we have scrub nurse, Mr. Sonu. He would be helping us with the surgery. So we are a team of 4 surgeons, Dr. Varun and myself. We are the lead surgeons. Dr. Subham would be helping us with the surgery, and Dr. Palak would be there helping us with the correction part. And then we have an anesthesia team consisting of a senior anesthetist and a junior assistant anesthetist who would be managing blood pressure and anesthesia during surgery and helping with the neuromonitoring also. Then we have a technician, Mr. Gaurav, who would be helping us with the tech part. He helps with the anesthesia part as well as with the C-arm, taking images during surgery, making sure that all our screws are placed appropriately. And the most important, we have Mr. Bittu, who is here. He would be looking after the neuromonitoring or the neurophysiology. So when we are doing the correction, he would be sitting there continuously monitoring the spinal cord and the nerve function. So as you see, it's a full teamwork of many people, and I am just leading the team. So I make sure that we are all coordinated. We all know that all the steps are very clear to everyone before starting the surgery. So let's start. Okay. So we have achieved first level of correction. We have applied rod on one side and achieved almost full correction. Now for the rest 10 to 20% of correction, we will be applying rod on the other side. In the meantime, Mr. Bittu, our neurophysiologist, he has taken the signals and he is more than 100% sure that the spinal cord is working normally. Here I am molding the rod as per the desired anatomy that I want to achieve. And this these days already is pre-planned. So we have 3D CT scan and we have complex softwares. We have already planned how much of correction do I need and how much bend do I need in the rod. So how scoliosis surgery is done, if you see, we have placed multiple screws. So what we will do now is, when we place this straight rod in those screws, the spine gets pulled to this rod and gets straight. So we have finished the correction. Now this is the C-arm machine. We are checking that our alignment is normal. So here we are checking the shoulders, that the shoulders are equal at the end of our surgery. Shoot please. Normally we use a OM machine to check that all our screws are well placed, but here we did not use it because we already did a CT scan before surgery and made sure that all our screws are okay.
So we have finished our scoliosis surgery. Now we will wait once the patient wakes up and moves his feet. That would give us a sigh of relief. We have got very good correction and we are very happy with the overall cosmetic correction. Very good. Yay.